I'm Maxine Whitaker, and I'm one of the founding executive members of the Australian Network of WHO Collaborating Centres. This Australian network consists of 54 centres across Australia, working across a broad range of different areas of global health. We're unique. We have the highest number of centres per capita in the world in Australia. This is a significant validation of the global health practice and research that occurs in Australia. In 2019, the Victorian Department of Health funded the Global Health Alliance Australia to establish this network, providing funding over 4 years to support and promote the WHO collaborating centres based in Australia. We're very thankful for this donation. A network maximises the value of WHO collaborating centres, both to the WHO and more broadly to global health outcomes in our region and more broadly globally. Our network has 3 pillars defined in its strategy: connecting, raising profile, and knowledge sharing. I'm one of the co-directors of one of the collaborating centres for vector-borne and neglected tropical diseases. We have 5 major activities defined for our network: training of program staff on epidemiology, diagnosis, management and prevention in vector-borne diseases and neglected tropical diseases to support and align with WHO programs, to provide technical assistance to support WHO develop new and implement current WHO strategies and surveys for vector-borne diseases and neglected tropical programs and their monitoring and evaluation, to provide, as requested by WHO or through their countries, technical support to design and implement neglected tropical disease surveillance strategies in priority countries, address lymphatic filariasis-related morbidity through integrated service delivery with other primary healthcare interventions to align with WHO strategies, and to implement WHO-aligned vector-borne disease and neglected tropical disease operational research. Being part of the Australian network of collaborating centres actually helps facilitate broader interdisciplinary approaches to the challenges that we face globally and specifically in our collaborating centre for vector-borne diseases and neglected tropical diseases. And this is linked to the strategic pillars of the Australian network of collaborating centres of connecting and knowledge sharing. Just a couple of examples. There are 2 collaborating centres in Australia that have a focus on children's health, one on child health per se, and one on children's health and environment. The questions, some of the things we can explore together are: how are children and the environments in which they live vulnerable to vector-borne diseases and neglected tropical diseases, like scabies? What approaches might be transferable from other health problems to our focus on vector-borne and neglected tropical diseases? So, why is it important to be a member of the network and have this network of collaborating centres? Well, firstly, learning from others is important to do for impact. A saying I work by is, if you keep doing the same things, you get the same results. And we don't want the same results. We want broader impact, reach the unreached. We want to make global health everybody's right and accessible. That universal healthcare requires every program that reaches underserviced populations to integrate other health issues into their programs. We have to do that by talking to, collaborating, and learning from each other. It often means services are more cost-effective. Communities don't want silos. They often want more integration. So working together, learning from each other can increase community acceptability and therefore utilisation of these services. So this network is a benefit to WHO in the region and globally. Collectively, we can achieve sustainable development goals. This network has a strategy with 3 really important pillars: connecting, raising profile, and knowledge sharing. And it's really exciting to be part of this network to achieve all of this and more.
My name is Professor Susan Sawyer, and I'm one of the co-chairs of the Australian network of WHO collaborating centres, a network that seeks to exchange information, foster good practices, and develop technical cooperation between collaborating centres, WHO, and governments. In my day job, I'm the director of the Centre for Adolescent Health at the Melbourne Children's Campus, based at Royal Children's, the University of Melbourne, and the Murdoch Children's Research Institute. And together with Professor George Patton, I'm one of the co-chairs of a WHO collaborating centre for adolescent health. Our main connections of that collaborating centre are through to the Geneva Department of Maternal, Newborn, Child and Adolescent Health and Ageing, but we also have major connections with WPRO, WPRO, and increasingly PAHO, as well as with a number of other UN organisations, particularly UNICEF and UNFPA. Having been missing from the MDGs, it's fascinating to see how central adolescent health has become to the SDGs. Certainly the impact of the pandemic on school closures has brought new attention to adolescent health, particularly around mental health and wellbeing, nutrition, and increasing concerns about too early marriage. The pandemic has also brought new attention to the role of schools, both as communities that support learning, but also as communities through which health development and wellbeing can emerge. Some examples of our recent work as a WHO collaborating centre are the new global standards and indicators for health promoting schools and an accompanying implementation guidance that we developed for WHO and UNESCO. And another example is a new guidance on how to plan and conduct teleconsultations with children and adolescents and their families, something that has become particularly important during the pandemic. As one of the world's leading groups on adolescent health, we have a wealth of expertise in adolescent health research, as well as training. And in addition to running a free, massive open online course on adolescent health that runs about 3 times a year, we also run a fully online postgraduate program on adolescent health and wellbeing through the University of Melbourne. One of the goals of the Australian network of WHO collaborating centres is to foster partnerships and collaborations that can advance WHO's aspiration for sustainable health for all in Australia, our region, and globally. Don't hesitate to reach out to the network itself or to any of the collaborating centres for information or technical advice, including my own. Thank you.
My name is Philippa Hetzel, and I'm the Director of the National Serology Reference Laboratory, NRL, in Melbourne, Australia. And we're a WHO collaborating centre for diagnostics and laboratory support for HIV, AIDS, and other bloodborne infections. But today, I'm speaking to you as a member of the executive of the Australian network of WHO collaborating centres to tell you about the network and what we're doing. The idea of an Australian network came from Professor Vivian Lin, who was working in WPRO head office and saw firsthand the effectiveness of similar networks in Japan, Korea, and China. That is, the benefit of collaboration in the home country before embarking on international activities and projects. Rather than thinking from the narrow focus of the collaborating centre's expertise, immediate efficiencies and greater effectiveness was being gained because of a more holistic approach across project design and delivery, more effective risk management, and as a result, a much more sustainable and broader impact was being made with better outcomes being achieved. We're very lucky that our secretariat has been funded because this really allows the network to function. Our Australian network is still quite young, and we're actively exploring better ways in which we can continue to collaborate together. But the knowledge sharing and the learning that's already happening is quite palpable and very exciting. We shared our experiences of the pandemic and the impact that it's had on our work, both here in Australia, but more particularly internationally. And we were able to present our findings and the observations that we had back to our government. This was so important because there was acceptance that our expertise and knowledge is, of course, very valuable, and it needs to be influencing our own government's policy. There are about 50 WHO collaborating centres in Australia, and there's such a diversity of expertise across all aspects of healthcare, which is really impressive. We've held a number of workshops and we've spent time learning about each other so that we can understand the best ways in which we can collaborate. We believe that as a team, by contributing and sharing our knowledge and expertise and the experiences that we all have, then by executing in a multidisciplinary approach, we'll be able to achieve so much more than we could as individual collaborating centres. It really is a case of working together is more. Thank you.